Well, I noticed one morning a lymph node under the arm. Asked my husband to feel it too, and he was also, this is not right, and I was not sure that it was not right, so I went to the hospital and examination, and the doctor figured out it was breast cancer. And she did a biopsy, so we came back a few days later and got the result that it was breast cancer and that it had spread to the lymph nodes in my right side. Well, I felt sad, terrified, frightened because cancer is this big disease that some do not survive it, but then starting to get back on track, would think that breast cancer is a thing that you get treatment for and that you survive, and so far I've survived 2 years. So it was, then I got very logical and saying, okay, what can we do about it? I had terrific cancer treatment here in Bangkok. It was, I had chemotherapy, I had surgery, I had radiation, and everything went just smooth, and I have only met good, competent doctors and nurses, and everybody knew exactly what they were doing, and I have felt very confident about the treatment. I talked to friends back in Denmark about the treatment, and even some of the doctors told that, they went to Bangkok to get to learn about breast cancer treatment. So I felt really comfortable about it here. My right arm started to swallow. It got hard on the lower part of the arm, and both underneath and on the upper part. And then I looked at it and looked at both my arms and said, this looks strange, different. So I went to see the doctor. Then I got in contact with Dr. Sasitorn here in Bangkok Hospital, and she is very, very, very good, knows much about lymphedema. So I was treated by her. She recommended using the arm sleeve and get massage, and then after a little while she recommended to do a surgery. The surgery was good. It took 7 hours, so it was a long time, but it was successful. So she did bypass, where she took the lymph strength and put into the veins down by the hand instead of doing it up. They do run into the veins by the shoulder. So she just did a bypass.
First of all, we have to know the lymph nodes are defined as a small structure that work as a filter for the foreign substance. There are lymph nodes under the arm we call the axillary lymph node. As their primary function, they drain the lymphatic vessel from the arm, most of the breast, chest, and the armpit. After breast cancer treatment, either with the surgery or radiation, it can occasionally result in the lymph node damage and scarring. The disruption of the lymphatic system, ability to drain fluid in this area. As a result, this can eventually lead to the buildup of fluid into the surrounding tissue, which is called lymphedema. The incidence rate of the breast cancer-related lymphedema widely range from 6% to 70%, depending on the reference. However, lymphedema is considered as a common complication after breast cancer surgery or radiation. As an unpredictable complication, lymphedema can happen in any times after surgery or radiation, varying from the few days until 2 years after the surgery. There are several treatment options to manage lymphedema, including the conservative treatment approach for lymphedema are skincare, movement, the lymphatic exercise, compression, garment or bandage, manual lymphatic drainage, and as well as the maintenance of the healthy weight. Surgery may be considered in some patients, such as lymphovenous anastomosis, lymphatic bypass surgery, to create the new route by the reconnecting the lymph and blood vessel in the order to facilitate the lymphatic system to transport more lymph fluid. Other surgical approaches are revascularized lymph node transfer surgery and liposuction. For this lady, she came to our hospital with stage 2 of lymphedema when she had right arm swelling. After applying conservative treatment for her condition, could not be recovered, while some early dermal fibrosis was present. She was doing well with the continuous pressure garment, and we performed ICG lymphocytography for evaluation of her lymphatic condition and advised her to undergo Lyphatical venous bypass surgery. In this surgery, we connect between the small lymphatic vessel to the small vein to drain the lymphatic fluid to the vein.
It took a few days, 1 week maybe. I felt fine. I have to say I've been very impressed by the surgery that I've gotten here in Bangkok, about being put to sleep and then wake up again, and being able to actually wake up quite fast and not feel dizziness afterwards. It's very amazing. Not that I have experienced. I think I need to wear an arm sleeve, but that's due to the lymphedema. I need to wear that all the time, but otherwise there are no side effects. I can carry, I can swim, I can do exercise, I can do everything with my arms that I could do before too. So there's no side effects on that part.
After surgery, she still have to continue wearing pressure garment and follow-up appointment for the evaluation on the treatment efficacy after 1 year of surgery.
I chose it because it has a good reputation, because I've talked to some friends about it and they said, okay, you can go to Bangkok Hospital. It's a good hospital for breast cancer treatment. And I felt very, very secure when I've come here, because all the nurses, all the doctors, everybody here is capable of whatever they are doing, and good at it. And my husband's EA recommended Bangkok Hospital too, because a lot of foreigners go to Bangkok Hospital for treatment. Regarding Bangkok Hospital and the expertise of the doctors and the nurses and everybody else who works here, I can really, really recommend Bangkok Hospital. Every doctor is a specific expert in what he or she is doing, and really I have only met doctors who are very passionate about what they do, and therefore they're also very knowledgeable about what they do. And it makes me, as a patient, feel very confident and comfortable. The cleanliness of the hospital is extraordinary. Of course, hospitals need to be clean because people come here when they're sick. But I think it's very nice and clean. The layout of the hospital is also nice. It feels almost like you're at home. Not totally, but almost as if you're at home. And it's cozy, it's nice. The colors. In many hospitals, it's very white and sterile, but here the colors, it's still clean, of course, and it's nice. I think I believe in coping whatever comes along, and we are here to live. We are here to spread joy. We are here to make life good for ourselves and for others, and we should do that in every way we can.